Yeah.
So,
So,
guys, I have one question.
mhm.
It's not something that's happening overnight and then next day everything is okay, right? So, what makes this challenging? Now, I did my homework, so I did a lot of research. So, what's happening is this is a period of like time, like it can be up to what, 7 years, 10 years. So it's a long time that you are going through this. So I think when I was doing the research on my side, that was the most maybe in a way frustrating part, because like it's not something that you have it done in like 6 months or 3 months. So this keeps happening. So then I was thinking that should we then discuss what are the ways to actually make this less painful for everyone. I say for everyone because while you guys are going through this, we live with you guys. So then I have my mom, I have two sisters, and then I have a lot of physicians, providers, and then I have a lot of people in the office. So we really need to be better educated without having a sign on the person, right? So like understanding what may be going through on the other side. So I guess perhaps if we can maybe focus on the ways that we are handling, how should we be handling it clinically first, but also from the social side.
Yeah. So it's a case-to-case basis. It's not a cookie cut kind of situation. So it's really a relationship between the doctor and the patient. So the patient, obviously when the patient comes in and they're complaining about this, it's a problem because they will not come to the office without that, it's not a problem for them, so they won't go to the doctors. So the moment the patients complain, you need to do something about it. So then it's up to us to say, okay, what's your comfort level? Because it's not like a life or death situation, right? It's what's your comfort level? So bottom line, we explain to the patient. So let's say a patient comes in, she has hot flashes, night sweats, she can't sleep, she has no medical problem, she doesn't have diabetes, she doesn't have high blood pressure, she's not a smoker, she's never been on birth control, then I would offer, no question, hormone replacement therapy. That would be my first suggestion, because not all women, when you say hormone replacement, they're like, oh, wait a minute. They're like, no, I'm not going there. But, you try to tell them, okay, what if it makes your life 30-40% a little bit better, make you able to sleep, you can concentrate, that fogginess in your brain improves, and you're not irritable, you're not like snappy, and they're willing to take it. And then I always tell them, okay, so you are responsible for this, and let's say take it for a year, and then after a year it's up to you, you can wean yourself off of it. So I mean, that when you say it that way, when you express it that way, it's more palatable for them, and they're more willing. But that's when a woman has no other medical problems. Especially if they're a smoker, then you want to counsel them on other problems because of the smoking situation.
Sure. So the patients who are coming to you, do they already know that they are going through something, or they don't know and then you are actually diagnosing them?
No, they know. They definitely know. Yes. The only thing that I would say is, because women can develop hot flashes, night sweats, even if they're still having their periods on a regular basis. So that's a more, I would say, murky kind of situation. So it really, again, it's a relationship between the patient and the physician.
Yeah. Kemal, if I can just say, to all the women that are watching today, experiencing, as the doctor said, the lack of sleep, the fogginess. I've seen women have to almost strip down to get out of their clothes. And if you're sitting in a business meeting, it's a little uncomfortable. Or the back of the head starts sweating, and so the hair grows wet, or you see someone starting to fan. Like, these are all real, true life scenarios that are taking place with women that are, entering into the menopausal phase of their life. Again, as a woman, I've had 3 children. I think I've bared enough that I should be able to skip over this part of it. And the fact that you just enlightened me that it could last 7 years, it makes me, yes, it is probably not tolerable. It won't be tolerable in our home if I have it for 7 years, for sure.
Well, I
Well,
also, sorry.
Go ahead.
I was going to say, so I think someone who's been through it, hopefully closer to the end of it, I think it is different for everyone, and it can vary from time to time, right? Because early on, I didn't have the sweats. I mean, I'll just full disclosure, I felt it more internal. So like my torso, I felt very warm, and almost like if you put your hand up, like almost like you could feel the heat like radiating off of me. So I didn't have it up here as much. But I've worked with people that would literally break out into a sweat, like you said. So I think you have to realize that it can be very different for different people. That was more for me. I did have the night sweats. That's where you wake up and you're like sweating, kick off the covers, and you're cold, and you put the covers back on. So it can vary. I mean, some days it happened multiple times a day. Other days, not as much. So, but yes, it has gone on for quite some time. And I think, again, being aware, and Dr. Belisena, maybe you can address this. I know for me, because I was only 45, but also your family and the history there, because my mom started very young too. She was less than 45. So I think also being aware of your family history and when, that may begin for you, could be earlier than for other people. So just kind of right, Dr. Belisena, it does. Yeah. There is a bearing, like genetics, right? And family history can play a part in that as well.
That's a
and
great
it really,
point.
yeah, and it really varies. Initially, people can have like really bad symptoms. Maybe I would say ballpark 1 to 3 years, but they dissipate. They really dissipate throughout, like moving into the 4th or 5th year. And some people, and the flip side too, like, oh, am I in menopause? Well, you asked the question, when was your last menstrual? I don't even remember. So is it more than a year? If it's more than a year, yes, you're in menopause, and they don't have any symptoms. I said, yay. And they asked me, do I need to take anything? I said, do you feel any different? And then, no, you don't take anything. They're like, oh, okay, because I thought I need to take something. No, you don't need to take anything.
Yeah. Dr. Belisena, what I think I also hear a lot of women talk about is the weight gain. All of a sudden, the weight gain is right in the midsection. And, people will say, well, I eat healthy, I work out.
Yes, unfortunately, yes. So that you're like, I think if I could count, you're the gazillion number questions. That's all I've been asked about. So anyway, so what happens, obviously, when we go through menopause, I mean, women, we're double whammy, right? Double whammy. We have our kids, our belly becomes flabby because of all the things that we need to do. We need to wash the dishes, everything. We don't take care of ourselves. We don't take care of number one. Mm-hmm. So I always try to say, please exercise, whatever shape or form. Doesn't matter to me. We need to exercise, right? And not only that, as we, when we're there in the perimenopause climacteric age, it's important for us to do weight training, because men, because they have the testosterone, they have the muscle mass, right? But if we don't do weight training, our muscle mass diminishes, and that's responsible for metabolism. That increases our metabolism. So that's really number one. That's the key there. The hope is if we increase our muscle mass, then the chances of us maybe increasing our metabolism, yes, and then losing the weight. But that's like, I wish I wrote something, but because that's always what I'm eating less, I'm exercising more. Mm-hmm. I don't know why I'm not losing the weight.
Yeah.
Yeah.
It's a true struggle. Yeah. Mm-hmm. And, at least when you're pregnant, that you're getting a beautiful surprise at the end. Right. In this case, the surprise is that it's just staying with you and there's no end to it.
Yeah. So we have to take care of number one. It's not being selfish,
There's
but
no
it's
good
really,
surprise here, right? So let me actually ask you guys, like maybe just address a couple of the different things. So one of the things is like engaging in mentally challenging activities, right? This is apparently helping to keep so the better positioning yourself. Let's say it's not going to make it. It's not going to make it a lot easier, but it will make it somewhat easier. So exercise and all those. But as I'm listening to you guys, one of the things that we see, Donna and I, we run case conferences, Senator. So part of our accountable care organization, every day we have 4 nurses, 1 social worker, 1 business development. She's running 1 team, I'm running 1 team. And what we have seen and what I learned a lot is how our social determinant of health becomes like the main factor. So everything that you are talking, like I'm talking to 3 very intelligent, very well-educated women in the society. But if this person who's not in your situation, with the poverty, with other social challenges, this issue is even bigger for them than what you guys are going through or what you already went through. Is that right?
not necessarily.
No?
No.
So like
So
they
it's,
wouldn't know
yes,
how
it's
to
not a
handle.
problem. It's not, well,
No, what
they
I meant was actually like, you know what's coming. Let's say you are better educated on this, but then people who don't know enough about it, they may not know what they're going through and then they don't know how to handle it. That's what I was.
from my experience, it's usually the more educated women that would complain, that would come in and
Right.
say,
Okay.
yes. And because to them, probably because of other issues, it's not even worth talking about or not worth complaining because they have other problems to think about and they're just dealing with it.
But that isn't that so interesting though? It's kind of like opposite of what we normally have in healthcare, right? So you are saying that they wouldn't actually realize what they're going through because they have a lot of other social challenges. Interesting.
Yeah, because what I find now, the women that come in and say something, about this is usually, they're working, they have a full family affair wherein, they're taking care of the children, but it's not because that they're not working but they're taking care like of four kids, driving these kids to all their school activities, but it's usually in the higher tier that this women complain. I mean, it comes after the fact. Like, when we do a review of systems, we ask this and this, like, do you have hot flashes, night sweats? It only occurs or it only comes up when I ask them, but they won't necessarily say that it's a problem for them. Yeah.
So then I'm again just thinking, since Senator also is part of the health committee, so perhaps we can maybe increase the awareness on menopause for those who may not have the same understanding or access to this. So again, it comes to the making them aware and they understand what they may be going through without it. This happens. Isn't this the same thing like with morbid obesity? Sometimes they never say anything about what they are going through unless physicians are approaching them. So it's kind of like similar to that. So that's actually interesting. So that's maybe something that we need to change our approach on our side. Now, so Senator was making some statements regarding the personal, what she was going through personally and what happens with the family. But the question would be, what do you suggest to the families or the friends, family members, how they should actually handle the situation? What's the best way to approach the issue, or should we not approach it at all?
So be kind, be nice, make sure that you are, doing all kinds of kind things for the women around you that could possibly be going through this. I think, right? I think I can probably write a whole list of things, but they would be the first things, Kemal, that I would encourage you as a man to make sure that you do.
That's important because I guess
Anyway, all the time, right? All the time. Not
All the
just
time.
not just during perimenopause. It has to be all the time.
But being 110% instead of
Right, Donna?
right?
Exactly. I'm making light of it because the reality is that I also would like to say that, oftentimes a woman may not realize that they're heading into this, right? Because is it perimenopausal, right? Where there might be some signs, but not necessarily because you might say, well, I'm only 45. There's no way I could, people don't go into menopause till they're 55, 60. And so they may not even realize that they're reacting, but it is something that chemically is changing in their body. And so I was making light of it, but just in reality to it, some women may not even realize that they're heading into this part of their life and because they're basing it on the age. Because I don't know, again, that we really are talking about this. You hear women talking about weight gain, you hear women talking about not sleeping and hot flashes, but I don't know that that's a big conversation right now happening.
Yeah, and not only that, maybe, as you said, women aren't realizing this, but you're seeing a lot of depression and anxiety as well during this time, and without them realizing, yes, it could be perimenopause, menopause, and that, it could be dealt with differently, not just with, medications for depression or anxiety, but also to take a look at the hormone on the level.
That's what I was
For
getting
sure.
ready to say is I think being aware of that the hormones can make us feel different ways. And if you realize what's going on or see a doctor to find out what's going on, then it makes you maybe better capable of handling some of those situations, right? Like some of the things that we would normally handle, very easily, and then we become more emotional in certain situations than normal. So again, being kind or being aware of what someone may be going through at that time.
But I think maybe what I was maybe also trying to say there is what I'm asking, should we also talk about it with them, or should we not bring it up at all? Like, I can be kind all day, so they know I'm always nice. But should this be discussed, or when should we discuss this? What's the right time to discuss this? So
And we're all silent.
So,
I don't think there really is any.
I'm trying to ask you uncomfortable questions for you guys, so that we can. Maybe there are people out there they want to ask the same question. So I'll tell you. Okay. So I hope. Well, actually, my sisters are watching, but so one of them is older than the other one. So I'm one of 4 kids. So oldest and youngest are my sisters. So I want to be able to, like, I can tell you, I'm probably guilty of maybe making jokes about menopause. And I'm not going to lie to you. So like Sean may lie about this, so he's here. But
I've never made jokes.
Other people may lie about this. But I'm just being honest. Where we do make jokes about this, even to the person who's going through this. That's why now listening to this, and why actually we were even talking about this from the beginning. Why we needed to talk about this from the beginning, because there's that social impact of this whole issue where we don't know how to handle it. Like when you say be kind and be nice, that's a little bit easier for me because I do love my sisters, but because it's family, sometimes we also kind of like torturing them with mean jokes. Like, should we even know that they are going through this? That's why I'm asking this.
Well, yes and no, because there's some women, they're freaking, like, I'm not in menopause. They really deny it. Like, no, So it's both sides. It's, as I said, you can't cookie cut it. There's really no right answer to that, because some women are, they're fine saying I'm in perimenopause, menopause, and I have this, like, be nice to me. Some others know, like, they don't want to even talk about it. So
because they're very private, or like
yes,
they're either private and or they don't want to accept that they're going through it.
Exactly.
And I think you kind of have to play off of it and maybe more general questions like, are you okay? How are you feeling? You know, let them be the ones, like, based off a general question, let them be the one to bring it up. Then you kind of know where to go. But I don't know that I would have personally want someone to kind of ask me, you know, excuse
Exactly.
me, are you going through menopause? Is that why you're cranky today?
Well, I also think, you know, Kemal, you know, maybe men don't realize, or maybe people in general don't realize, you know, when a woman is having a hot flash and they're taking layer after layer off, that there is a chemical reaction to whatever's happening in their body. And, you know, I can speak for myself back in when we were having children. In order for me to get pregnant, I had to do a short stint of menopause through IVF drugs. And so I had the onset of the menopause and the hot flashes. And they could be pretty grueling, but sitting in a business meeting as you're sweating through your suit is not a very comfortable position to be in. And so you have to kind of work through it. And fortunately, no one said anything to me, but I'm sure they probably thought, wow, she is red like a tomato. And now she is down into like a t-shirt at this point from a business suit. So, but maybe just knowing what the signs are is just enough to reinforce, like, okay, this person is having some challenges at this time.
No, that's helpful. So what else would you like to share regarding menopause? Any suggestions to those who may be going through menopause or who are about to go through menopause? What's the best suggestion you would give them?
Also, on being nice to yourself too. Like, women are very hard on themselves, period. And they want to be, they want to present themselves in a way that, especially as you said, Senator, when you're in a business meeting, you have your, set preference. And then when these things happen, it's uncontrollable. You cannot control these things, right? So then it's on you. So then that's who I am, and deal with it. Like, it doesn't take away from who you are really. It's just a phase of life, and understand that it's going to get better.
Yeah. I love that. Right. Be kind to yourself.
We have to. We have to. Yeah.
And I liked whoever just mentioned a moment ago about the awareness, because I think, right, we spend a lot of time talking about other diseases and other illnesses, right? Awareness. We have Awareness Month for various different diseases. And I think you're right. It is an awareness that it can, affect people very differently. People can have, different symptoms. They can have some symptoms early. They can have worse symptoms than other people, but we have to be accepting of how they're feeling about their symptoms, right? So someone can have more mild symptoms, but maybe be feeling worse about it than someone who has, more severe symptoms. So I think it's just that awareness of allowing everyone to perceive that, for themselves, and to work through that.
I also want to stress another thing. Yes, this is finite. This will go away. It will get better for sure, but the risk for cardiovascular disease will increase. So that's what we really want to hone in and make sure that our women are being aware, that they're being counseled, that exercise, stop smoking, make sure you get your cholesterol checked, your blood pressure checked. Those things are critical, really, as we age.
I was going to say that I think the annual physical, not just for women, but for men as well, and just like for kids, everyone should be having their annual physical done, because those are time, because you want to be preventive. So you don't want to find out any type of issue, not just for this. Prevention is the key. And because we cover so many different topics, the common elements are exercise, smoking, being positive, seeking support when it's needed, weight gain. So these are all the stuff that we find in many other health issues as a common element. So the best would be to be ready. So to get ready for any of these challenges. So I think that would be the key. Well, hopefully this was a useful discussion for those who are listening to us and to you guys. And definitely I learned a lot. And one thing that I know that I'm going to be nicer to my sisters. So, and again, this is just like learning and understanding what others are going through, just so that if we know more about what's happening, then we'll be able to also position ourselves better. And that's what we are trying to do from United Medical Accountability Care Organization side as well, because we deal with so many patients in different challenges. And one last thing I want to just reemphasize what Dr. Beltsana mentioned earlier. People who have other social issues, women who have other social issues, social challenges, they are not even aware of what they are going through. And that actually makes it even maybe more complicated, not knowing what's happening. So we want to make sure that everyone has equal opportunity to understand and know better about what they are going through. Well, thank you again. So this was a very fun session for me, and hopefully